everybody. Before we start this week's episode, I wanted to thank one of our sponsors, Partners Dental Studio. Um, they're your lab, all things ortho and airway, rooted in five main promises: quality, innovation, consistency, dependability, and communication to ensure that your practice thrives. Partners promises unwavering dependability in every aspect, from timely communication to precise delivery, ensuring seamless orthodontic treatments and satisfaction. Together, we create lasting smiles that impact lives. Give them a try. There are links in the podcast. Back to the episode. Hey, everybody. Welcome back to another episode of the ASAP Pathway podcast. I'm your host today. And again, honored to be with my partner in crime. So Dr. Stacy and Dr. Tracy today. And then
Hi.
we also we also have the most amazing guest today, Dr. Audrey Yoon. And I feel like she's like a silent partner. She's been on this journey with us for years in this platform. And we definitely wouldn't be where we are today without all the hard work that you have done. So I'm just so honored that you're here today and sharing your busy, busy time with us. Welcome.
Thank you for having me. It is a pleasure to be here.
For those, and I don't know if, I mean, I'm going to do a micro introduction of Dr. Yoon. Her bio is huge. It's impressive. I have so much respect for her. But for those of you who do not know Dr. Audrey Yoon, she is a dual trained orthodontist and pediatric dentist who specializes in sleep medicine. She established the World Dentofacial Sleep Society and serves as a founding president. She's also a diplomate of the American Board of Dental Sleep Medicine and a diplomate of the American Board of Orthodontics. She's currently a clinical professor of Stanford Sleep Medicine Center at Stanford University and an assistant professor in orthodontics at the University of Pacific. She founded Pacific's Ortho Dental Sleep Medicine Fellowship at the University of Pacific and serves as a program director. She is a board of directors at the Edward H. Engel Society of Orthodontists, Northern California, a board of director at the California Sleep Society, and international board of director at the Korean Association of Dental Sleep Medicine. She completed her orthodontic and pediatric dentistry residencies at UCLA. She also earned her Doctor of Dental Surgery and Master of Science degree, completing extensive research in obstructive sleep apnea at UCLA as well. She practices the full scope of non-surgical and surgical orthodontics from the pediatric to the geriatric population for airway management. And here we go, a lot of abbreviations, including growth modification, pediatric palatal expansion, customized mini screw assisted rapid palatal expansion, also known as MARPE, distraction osteogenesis maxillary expansion, known as DOME, orthodontic treatment for the maxillomandibular advancement, MMA, clear aligner therapy, and oral appliances for sleep apnea. As you can tell, she just doesn't do much. You are amazing, Audrey. You
Thank
really are.
you. I'm flattered.
I wanted to dive in because we all know you've been very heavily involved in research and dental sleep medicine. I think, is your orthodontic residency the first one that includes sleep medicine? And
You
then,
can say it. Even during my residency, I didn't see the connections, but that time I actually kind of started doing sleep apnea research because I was able to meet my mentor at that time, Dr. Pe, and then Dr. Ronald Harper. Probably you read his article, all the brain research that what happened after the hypoxic conditions. And he was the professor that time at UCLA, all those MRI brain research. So that time, actually, I was honored to work with them, and I ended up doing my master with them. So that time I kind of learned the sleep apnea and I published the articles, but that time was more basic science research and brain research. on the red model, I really didn't have a good connection with the ortho and the sleep apnea. That journey started later after I met CJ. So that is like 10 years later.
For those who don't know who CG is, he is like the father of sleep medicine. Um, his name is Dr. Christian Guilleminault, the late Dr. Christian Guilleminault. We'll talk about more about your relationship with him later because it's really an interesting story and quite a journey that you two went on together that I think would be great to talk about. What I wanted to really kind of hone in on, and then Tracy jump in at any time, but was the World Dentofacial Sleep Society. For those of you who aren't familiar with that, it's been out, what, about a year, year and a half?
Year and a half, yeah.
About a year and a half anniversary. Congratulations. And those of you who you want to become a member, there's also the Sleep Society, the WDSS Congress coming up this fall. But if you want to check out the website, it's dentofacialsleep.org. But I wanted to talk about, like, why did you start that?
So it's a long story, but yeah, we will have wonderful meeting from November 7 to 10 at the San Francisco Airport Marriott waterfront. And the weather is typically great at the time of year and perfect time to visit Napa Valley afterward. So I invite all of your listeners to join us to become a part of this history event. How I started is a long story, but the World Dentofacial Sleep Society started from a big idea shared with my mentor, Dr. Christian Guilleminault. So CG, we call CG. He was a legend in sleep medicine, and when we went to international sleep meeting, I'm only one of very few dentists and orthodontists who attend this international sleep meeting. And CG always talk about how we need more orthodontists and dentists in the sleep medicine field. One time it was IPSA in Taiwan. He even challenging me, Audrey, can you bring ever 100 dentists to sleep meeting? You know.
No problem.
I try. I felt his spirit is with us today, like while we are doing his podcast. I mean, I missed him so much, but his encouragement was really the spark that got things rolling. So in the history, there are two international sleep organizations. I'm talking about medical organizations. So CG founded WASM, that was a World Association of Sleep Medicine. And then Dr. Klee Kushida, who is my current mentor at Stanford, he founded World Sleep Federation. And there's two international sleep society merged to one. So they collaborated to found one international organization, which was the World Sleep Society. So they merged to one in 2016. And after they merged, they had a first sleep meeting was in the Prague in 2017. And that time, CG really, pushed the dome and Morphy technique. So that was a big hit. We had like over 7 symposium presentation during the World Sleep Congress about, we're talking about all the maxillary expansions. And that time, Dr. Leopoldo Korea, that was his first the sleep meeting, he was in the audience. And I guess he was impressed with my talk. And then later, my flight got delayed in the Prague airport. And I ran into the Leopoldo again. And so we end up having coffee, and he suggests that we should collaborate, we should work together. And then he said, oh, maybe we're going to possibly creating the pediatric dental sleep medicine mini residency at Tufts University. So we suggested to the Tufts University, and Tufts wanted to test the water. So we had a 1-day pediatric dental sleep seminar. I believe, Tracy, you were there at the 1-day Tufts University seminar. And our program was sold out in a week. And then we had the best feedback from attendee in the history of Tufts University CE courses. Like everybody gave 5, 5, 5. And we convinced them to start. That's how we started Tufts University Pediatric Dental Mini Residency Program. And they let us to, let me planned whatever the program. When we started running this mini residency program, more than half of our attendee actually travel from different countries. Like we had over 25 countries attendee, and many of them had no prior education in dental sleep medicine. And through them, we had a few messages, like dean of several dental school in different countries reach out to us, ask for help in building their dental sleep medicine curriculum in their university. And we really realized there's no set global guidance, and there is like
Right.
yeah, they need a guidance. So there are a lot of small group here and there working together, but we are not communicating together. There's no guidance. It's like sometimes it's a wild west. Some of them is really like out there. So we thought that, okay, we need to actually put all people together and then learn each other, and then we need to come up with a new guideline and set the standard. And one memorable night, maybe perhaps many wines or maybe too many beers, the Leopoldo and I decide to form, okay, we're going to make international organizations. And then we wrote the name on the napkin, like many names. I still have the pictures of the
Oh,
napkin.
I love this story.
But then, now there is now World Sleep Society, but there's no Dental Sleep Society. So, and we want to collaborate with them. So why don't we have a World Dental Sleep Society? But then I don't like the name only dental, because we do more than teeth. We change facial structures.
Yeah.
So let's put the facial in there. That's why it became World Dentofacial Sleep Society. But then my mentor CG passed away right after, and COVID, the pandemic, slow things down. So I thought it's gonna be a while, but then I shared this idea very casually with my current mentor, Dr. Klik Kushida. He's the head of sleep medicine at Stanford. And I just to talk about a little bit. And then the next day, Dr. Kushida wrote me the long email, came up with a game plan.
Oh, wow.
He's the one who found the World Sleep Federation. He also was the founder of a California Sleep Society. So he know how to do it. It's just, I think I was lucky to talk to the right person. He just gave me the game plan, and he said, Audrey, this is the right time. Do it now.
Yeah.
And because the next year we're gonna have a World Sleep Society meeting, and we are actually making program. And if you want to join, this is the right time. And he just gave me a few names to talk to, and you just need to know a few right person, right? So within a week, we complete the required paperwork. Just like that, we just became official. So, and this is like how the WDSS came to be. We wanted to really have a dental and medical professional
Yeah.
together to have a better understanding. So it's
And
been crazy, but amazing journey.
it's funny you said several times in the story, as luck would have it, you got stuck at the airport and then you start talking and then another meeting. And I believe that things happen for a reason and people cross each other's paths for a reason. And I just don't even know if there's a better person in the timing of all of this than somebody like you and the group of people that you are a part of to do this. I mean, this is good timing. Don't you
Yeah.
agree? Like, Trace, like, I feel like the temperature of the environment right now is so ready for something like this. Don't
Well,
you?
yeah,
I
I
mean,
mean, like, I think Audrey's having an amazing year. I mean, she's probably one of the leaders in putting out the research and
mhm.
and advocacy for interdisciplinary care. And I think that's one thing that is really important, that when you advocate, dentistry's involvement, you're advocating dentistry's involvement in an interdisciplinary setting. I mean, like, one of her landmark papers that she got published was in the Sleep Medicine Journal, and I think it was met with a lot of resistance in the dental community, but I thought it was interesting because we talked about it at the Coy Center, and I said, I don't think what people understood what this letter meant. This letter was a cry to the medical community saying, hey, this is who we are and this is how we can help. It wasn't a letter to tell orthodontists how we should do work. It was more of an educational piece. I mean, and I thought that was amazing because the medical community really don't know what we can do. I mean, like I was just at the ADA, and one of the doctors that was on the panel with me, and it was interesting. It was basically about, dentistry being a part of your overall oral systemic connection. And the doctor on that panel, he said, he turned around and he looked at me and goes, Tracy, I didn't know there was an answer beyond CPAP.
Mm,
I mean, like, and that's being very honest about their
yes.
education. And so, and I was like, yeah, there is. And he goes, I really enjoyed this. And I think, I mean, to Audrey's credit, I mean, she's not telling people how to do dentistry. She's telling the medical community what we can do. And I think that's huge.
Yes.
And I think that what you're doing with the World Dental Sleep Society, I mean, that's amazing right now because there is not an organization right now that has connected with the community outside of AOSH. AOSH is really great of doing dental and medical, but when it comes to like airway management and sleep, I mean, Audrey's group, the World Dental Sleep, I mean, it's amazing what they're doing. And I September, November
November.
in San Francisco, I mean, it's going to be huge because
What?
like if there's a place that you want to actually meet other professionals outside of dentistry and hear
Hmm.
about procedures outside of dentistry, that's the meeting to go to.
I have the flyer. So I was like combing through it, and just to list some of the nations represented, and the featured speakers. I mean, it's like medical doctors, dental. We've got so much collaboration. There's Italy, India, Spain, Colombia, Singapore, Taiwan, Chile, Australia.
And Stacy, you have all of the researchers that have the biggest papers on her panel. I mean, you have Maria Villa. She's the one that
Hmm.
wrote the 2-year follow-up on expansion and OSA, which I think you should probably have next on your
Yeah,
podcast.
I
But
need to reach out to her. Maybe Audrey can connect me with her.
so for having all those speakers, I mean, to have all of those people and to see them in like 3 days, I mean, like you almost get a little bit starstruck because everyone is that part of academia.
I feel bad. Yeah, everybody speak only keynote speaker 1 hour, even feature speaker only 30 minutes, and then most of speaker talk 15 minutes. We have too many speaker packed.
Oh,
So
but that's good though. Like in the Restorative Academy, like I love when it's like action packed because it's
Mm,
kind of like what's my take home,
yeah, but you actually get a lot of informations,
Mhm.
and yeah, some of the speakers they are like big names. They're big name, and I feel I'm so honored they are willing to come because we are nonprofit organizations, so we don't even offer honorarium, and they are willing to fly international and just to do it for us. It really means a lot. Like it's been only 1 year. Since we established, and now more than 11 countries dental sleep society became affiliated society with us. Pretty much most of the current existing dental sleep medicine society out there are collaborating with us. The thing is that not many country has a dental sleep society, so we are really pushing those countries that don't have a dental society. So this year Hong Kong and then Malaysia launched their own dental sleep society. And then my current fellow will start society in Kuwait next year. And
wow.
there is a little movement in Philippines and Thailand. So I mean, just it's happening. It's just more than community. It's kind of movement and camaraderie, with the like, common missions.
I agree. And it's very exciting right now. I say this a lot, but I really believe it is just an exciting time to be in dentistry, in the dental profession. I think the collaboration over the next 5 years, and 10 years between medicine and dentistry is going to be huge. And the acknowledgement of sleep is one of the pillars of health, and especially in children. If we can get to these kids early, I think it's exploding. And I think, like I said, this is the perfect timing and nobody um, better than you to get this started. And you say you're so honored. I think so. This speaks to. I mean, I'm looking at all of these people. These are amazing, amazing people in research right now, and that speaks to you that they would fly to be a part of something that you've put together, Audrey. That says a lot about who you are as a person. I think that's you're so humble. You've always been so humble. So I just wanted to toot your horn because you don't toot your own horn enough.
Well, yeah, I mean, like all of these people said yes to Audrey. It's
To
not like everybody
Audrey.
else
It's
asked,
yes.
it's like, and they understand, like I said, I mean, anyone that knows you knows that she's about bringing people together. And I think that's the key with this field is understanding our limitations and at working together. Um,
Well,
but yeah, it's really,
agreed. And like Tracy and I were talking, or Tracy, Michelle, and I talk about this all the time. Like, we're so grateful that we have each other on this journey because starting ASAP was and is still, it's like your love hate. You love it and you're so passionate about it, but you also are tired and it does take up time. And it's sometimes you hate the thing you love and you're a part of. And even Audrey, like, talking with you, you emailed me and you're writing a chapter for a book, and you're doing so much on top of a private practice, on top of being a professor, on top of starting some something so needed in this world internationally. Um, it's not easy, and thank God we all have each other and we want to lift each other up. And so what's the journey been like for you? And you're a mom. I mean, like, come on. So what's it been like? Because I know this has been tough and a hard journey, and what's it been like for you to
I
do
know,
this?
I know. I mean, but then at the end, I feel I get energy from people like you guys, like surrounded by the good people. I think that is at the end that actually make me going, right. um yeah, it's been, you can say tough, and it's, I committed a lot of stuff. um that I think last weekend I was kind of writing down what was due, and I still need to submit 3 book chapters, um, 4 papers. One is a revision,
Oh my
and
goodness.
then I'm running the welcome party for the new fellows. And then I'm actually, my LA office actually moving. So
Oh, you're kidding.
yeah, so we build from scratch to the new office. Is like about 90% construction done. And actually this weekend, actually tomorrow and this Saturday and Sunday, we're gonna have a little kind of a training going on, in not even finished the construction. So I get stressed out that I actually that I ordered the chairs and tables and all those. And then my son, only son, is applying for college. So this is critical year that I have to look at the schools and just he's a summer package, and then looking at their summer program. So yeah, it's so overwhelming.
It is overwhelming. And I tell you what, to the mom side of things, it's nobody prepared me for how much my kids needed me at that age for college and for these decisions. There are big decisions, and you want to be very present because, sometimes I feel pulled and scattered and I have to, like, okay, what needs my attention right now? What could I put on a shelf right now and focus on that? So I understand what you're saying. And the fact that, but I'm sure he's so proud of you.
Yeah, yeah. I'm very lucky that I have very easygoing, healthy, mentally and physically healthy son who doesn't need a mom too much, but then still love me whenever I'm around. So I'm very lucky to have a perfect son. And I think at the end, I still I feel appreciate everything what I have, that I still am healthy and have energy to do this. I just try to, I say, surviving versus thriving. I
Yes.
always, so I try to thrive, but maybe I just survive today. And so I have like a to-do list. My to-do list is long, but somebody actually teach me so how I survive every day, maybe little tips. So I have like a big, on my diary, I have actually 4 sections. Well, on the top is very important and then very urgent. On the right is important, but it's not too urgent. And then on the bottom is not very important, but it's kind of urgent. And then on the bottom is not very important and it's not very urgent. So and there is like a to-do list. Like a crazy day, I try to do only on the left to top corner, the most important and urgent one I try to do per day. Just I have my to-do list. And then if I have some time or like a breathing room like today that I'm available because my Chicago meeting got canceled. So then I'm trying to do other sections. So I have some, like on my diary, I have a different level of a to-do list and then my daily to-do list to kind of survive. But then I think this 4 section kind of give me kind of reflect what I am doing. So I have like kind of 1 year goal. I don't have 10-year goal, but I have like 1 year goal and then maybe next 5-year goal, that what I want to do. And then I get like a little bit more detail. But I'm always like overdue. I'm
I know. I mean, there is no way we can get
always
to
ask
everything.
for the extensions. I'm so sorry, and I for the extensions, but um, I think that's how is my survival skill. But I think recently, I'm trying to take care of myself. That it became a little bit higher on the priority. That
Good
my
for you.
yeah, my health is not as the same. I still don't have time to do exercises, but at least I try to get my sleep time because I teach sleep. I know how important the sleep, and my sleep is always compromised. So I try to get my sleep quality is one of the top priority. And then now I have a like aura ring
Oh,
and
I was wondering. I have mine too. I was wondering if you had an aura ring on. Tracy
yeah,
lost her. Tracy had a nice aura ring and then she lost it.
Yeah, and then I lost it. You're like, oh,
But
but is
so
what
for
I was
example,
doing.
yesterday my sleep was not good, and today it's like, okay, I'm gonna make up. I need to pay my sleep debt. I'm gonna sleep 2 extra hours, whatever it takes. Don't bother me. I'm in the
I was wondering, is that technology still the most advanced right now? Because I know Samsung is coming out with a ring. I'm
Samsung watch. They gonna do even sleep test. The sleep.
yeah.
oh,
I
wow.
hate watches. I don't. I love
You mean the
rings.
wearable? But I think in terms of home sleep test, not everyday wearable, but there are so many good one out there. Uh,
Yeah.
home sleep test. So again, go back to World Sleep Society. We're gonna have all wearable talking about in our Thursday course by Dr. Umakan Katwa and Dr. Jerry Simonson's, the favorite two
Mm,
sleep
But
physicians.
that was a hot topic, wearables, because
yeah.
everybody wants to be able to like test them out. It was so
Yeah,
crazy.
and now there are so many new home sleep study out there. So they're all different technologies. Some of them from the jaw movement. Some of them is still there like a traditional actigraphy. Some of them is heart to variability. So they have like a different technology, but there are so many new ones. There's some of them on the chin, some of them is forehead, some of them on the in the ring, some of them is on your wrist, and they have all different report. And nowadays is relatively good price, relatively cheap. California now the dentists are allowed to order home sleep study.
Okay.
We cannot read it, but we are allowed to do it. So we kind of
When
bypass.
did that when did they allow that in California? Because I know Texas and California have kind of been some obstacles there.
I heard 6 weeks ago. Yeah,
Okay. I
6 weeks.
think Tracy just jumped off. She waved goodbye to everybody. So Tracy just left, just so everybody knows. So you said 6 weeks ago?
Yeah, yeah, 6 weeks,
Wow.
6 to 8 weeks ago. So
Okay.
one of the good dentists in California really push. So we are able to order. We still cannot read, but we still
Right.
order then the home sleep study. And then once we get the report, now you know what to do. So I think it's important to kind of read what it means because a patient going to bring it and to how we actually implement to our patients. So I think that will be very hot courses, and I picked the best speakers. So
You did. I'm seriously looking through this, and you guys need to go check this out. Please go check this out. Dentofacialsleep.org/register to go. And you can also join membership. There's a section to become a member, but you got to check out these big hitters. I mean, like I said, I mean, these are amazing topics. And what's so interesting about sleep? I mean, sleep medicine is a newer science among all the other branches. And such an important one. And good grief, pediatric sleep medicine is even newer.
Mhm.
So things are changing and very dynamic. And those of you listening, any healthcare providers listening, it's really important to be part of some kind of community or organization that's giving you the latest and greatest. And because the information's coming so fast, and it's good to have somebody that can kind of help you decipher and pull it all together and at least be able to go to a meeting and how can we best help our patients and our even our families, to be their best selves and healthiest selves. I wanted to go back to CG and
Yeah.
how you met CG and how you even got involved with that in Stanford. I mean, do you mind? Do you have a few minutes to talk
Yeah,
about that?
maybe I go to the short version. So
Okay, okay.
my life profoundly changed about 11 years ago when I met my mentor, that CG. I was introduced to him by Dr. Stanley Lu.
Yeah.
Now he's in the Nova. I think he's a chair in the Nova Southeastern University. That time, as an early adapter, I was playing with MARPE, minuscule palatal expanders. This is the time where MSC2 was not even out yet. So there was some like the new early version of MARPE from Korea, like from Germany, and some I think Dr. Moon was kind of playing with the initial version. And then I'm an oleo adapter, so I use MARPE on my patients to expand the, you know, palate skeletally. And then patient is saying that they can breathe better. Some of them say they don't need a CPAP anymore. Some of them, they say they are able to reduce their pressure setting. So I thought it was a good idea to use this MARPE to our adult sleep apnea patients. So that time, the MARPE was only we using for dental reason. So the originally the first meeting with CG was supposed to be just quick. His office meeting. So Stanley said, "Oh, I'm gonna make you to meet CG on like his office." It's supposed to be like a really quick meeting. And I introduced the new concept of the MARPI. When I show him my cases, you see CG's eyes getting, and he's so excited. CG is the one who actually published the expander help for sleep with Dr. Paola Pirelli 2004. So he loves orthodontics, he loves surgeon, but he always knew that this is not possible for adults. And then when I show, he's like eyes
His
pops
eyes.
out, and then he just pull out the pen and he start designing his own version of mini screws. Like
Oh,
the Christian he's a neurologist. Despite his lack of dental training, he enthusiastically became an implant designer. And then, like, we found ourselves sketching implant and different MARPE design and exploring how they could be applied in the field of sleep medicine. And supposed to be brief meeting turned into be like inspiring 5-hour marathon of creativity, innovation. And after meeting, I even design on the computer and send him email. I still have that email. But then at the end of it, CG says, Audrey, you will speak the WASM World Sleep Society meeting in Seoul, Korea next year. So like I think you're crazy because I don't have any cases. I don't have any research to share, and you put me on this like a big word, international stages. And he says, Audrey, you show the possibility to the world, and
That
that's
is
him.
so well said.
That's him. Like at that meeting, my life changed. So it's all about possibility in
It
imagine.
is about the possibility. I think that's what too, like, Audrey, when we all talk about this, and of course, there can be some heated sometimes back and forth, and there's just so much that we see and that has happened, and quality of life changes for so many people that the possibilities, it's our responsibility to investigate these possibilities and to help people. I mean, I understand we throw the word obstructive sleep apnea around a lot with this, but even in the medical community, they're challenging the algorithms and even the um organization of this disease, this condition, obstructive sleep apnea. And really so I mean, we're still even diving into what are we even, people are being helped, but what is it that we're helping with? We're still trying to figure all of that out. I mean, I remember the first time I saw CG, it was when he spoke at the American Dental Association's first pediatric airway symposium, and he stood on stage and the whole room got quiet because it was CG. And then he stood there and everybody was waiting for what was going to come out of his mouth.
Yeah.
And in his strong French accent, it was, I don't even know what obstructive sleep apnea is, you know? And he was so humble. And everybody was like, wait, CG doesn't even know what obstructive sleep apnea is. But here we are still. He's honest and brave and progressive. And we're also grateful. And I feel his spirit here too. I mean, I we're just also grateful for what he has done and the platform he's given us for this collaboration. He has been banging the drum for collaboration between dentistry and medicine for a long time. And I
I mean,
think it's going to happen.
yeah, that's how actually I wrote the roadmap paper too, because his passion and vision for pediatric sleep was very, very strong. He had those vision that, like you, at the end, sleep medicine has to be preventive medicine, and he also inspired me to develop some growth modification protocol because people, you think but most of people doesn't know. You need to give some roadmap, a guideline, and you need to help our kid imagine, come up with a new idea and test it. The power of imagination can transform the medicine from treating disease to preventing them.
Mm,
And he has many brilliant ideas. He really encouraged to open my eyes. And same thing is like CG, like if I try to publish, I don't think it's publishable. We don't have any evidence. And you just give them the guidance, and then you let the people test them, and then you accept this is wrong. If it's good, that you improve, and that's how we improve our field. And years after his passing, the sleep expert, including Dr. David Guzal, Dr.
mm,
and Dr. Rafael Pelayo, and I mean, these are big names, basically saying it's time. So that's how I was able to publish the roadmap of craniofacial growth modification for children in the Journal of Sleep. This is his journal. He's the one who found that journal. And that was actually dedication to CG. And I feel like I complete the long overdue assignment, like homework,
yeah.
after 9 years he gave to me. But yeah, that's so I feel like his spirit is still here when I'm when we're talking about him.
Yes, I love this. You're also going to you have chapters and books coming out, and that roadmap is going to be in the pediatric. So for pediatric dentists, which that's huge.
Yeah. Yeah.
That is a big deal. Um, I know you're busy. I appreciate you being here today. And I always end with 3 questions. So, do you mind if I ask you 3 quick questions before you get off of here?
Sure.
Okay, she's like, you did try to get him out of me earlier, and I said, "Nope, I'm not gonna tell you." Okay, these are simple. First, because we were just talking about how busy you are and everything. What is one of your biggest passions outside of your profession? Like, what's something that you're passionate about that has nothing to do with orthopedics?
I love cooking
Oh,
as
I love it.
and I like traveling to kind of new places.
I have seen on Facebook that your son likes to cook too.
So he's actually a good cook. So we actually have very similar tastes. So we sometimes cook together while we're gonna eat together. So when we go to new places, even though sometimes through the work, we always just find the good like go to restaurants, and we buy some the local recipes, like a local
Mm.
little those spice and stuff, and then we try to cook. I think tonight we're gonna cook some Singapore chicken.
Oh, that sounds good. That sounds so good. Well, post a picture. Send me a pic. Second, what is your favorite season of the year?
Yeah, it's supposed to be winter, but then now I live in California, so we don't really have a winter. But I love snow, and I love skiing. So that is another thing. On the winter season, we go skiing, and I think my 40th birthday, my bucket list was doing heli skiing.
Oh my
So I
goodness.
so I we went to Canada, and we did a heli skiing when I was my 40th birthday. So my 50th birthday coming next year in Singapore. So when you come to World Sleep Congress next year in Singapore, we're gonna have my birthday party, 50th.
Yes, let's do it. I'm gonna be 50 in a few weeks, so I'm right there with you, girl, with the
Oh,
50th.
we can have
I
a joint party.
Yes, yes, it's like I can't even believe 50, it sounds like, but maybe I think 50 is the new 40, at least that's what I'm telling myself. 50 is
Yeah,
the new
50th. Yeah, I'm not doing ski. I'm just having party with
40.
my.
And then my final question, and as I wrote it down, because I was just curious myself, only because I was dealing with this myself today, but I don't know if with all your travel, if you have this as an option, but do you have a pet?
I don't have pet. I don't think I can afford to have a
Well, I'm like, as I'm sitting there, I'm like, I wonder if she has a pet. Um, but I'm thinking with all
to
your
have.
travel, how could you have a pet? If you didn't travel so much, would you have a
Uh-huh.
pet?
Yeah, yeah. I think when I retire, I'm gonna have a little cute puppy.
Aw, I love it.
I grew up with the dog. So when I was my childhood, I have like probably 6 different dogs. But then after I moved here, so I live with my in-law, and my in-law hate
Oh,
the.
they're like, no dogs.
And when my son really wanted to have pets, so we had a hamsters, and then we have a 3 hamster, but they all kind of
Mm.
die within 6 months, and we end up having a little puppy. But then, as you know, your son want the puppy, but then they really play with it 30 minutes, and they
And they're done with it.
done with it, and they all become my job.
Yes.
And my in-law doesn't want to touch. So when we had a pet, my pet sleep whole day. And then when I come home, they just like jump at me and ask me to play. So the whole night I have to play with them. And it didn't work out. So after 6 months, I have to give to my assistant. But yeah, I mean,
But
when
you
I
You are a dog person, though.
I'm a dog person, yes.
Yeah, I can see that in you. I was wondering, some people are cat people, and I was just trying to guess for myself. I thought I would like to ask her that.
I
Well,
had a
thank
cat too when I was a little. So when I grew up, we had a cat and dog at
oh,
the same household. It's very funny. When they are baby, they actually hang out together. They're like a they actually hunt together.
oh, well, they didn't know they were, arch rivals when they grow up together, cats and dogs. They just think, "Hey, we're in the same litter."
I remember they actually catch some little like bird and even like a small rat, like a small mice. So and then like my Jindo dog was kind of chasing the rat, and then Ray like the rat is like kind of running, and then my cat kind of hiding the corner, and then caught it, and then they're like so proud. Like, okay, this is the 2 days our catch, and they put it in front of our front door like every day, like today catch 1, 2, 3, like the two. But then when they get older and become a little big, they don't talk. They just go to the different side.
That is so funny. It's like they had a system of hunting together, and, it is funny how they bring you their whatever their kill is, like,
Yeah.
they're so proud, and they wanna show you, and they bring it to you, like,
Yeah.
Look what I did," and you're like, "What is this on my porch?"
So every day, like I'm afraid to open the doors. What is in there?
"What is it today?"
What is it today? And then they get like all those like a little game, like a small, like a sparrow. Or, I mean, yeah, so we didn't have any mice and red for like
Not with
100.
those 2 hunters. Oh, I love it. Well, thank you, Audrey, and you know what? I'm glad, you have the day to kind of, get caught up. Sometimes these, like I said, everything happens for a reason, and your day was gonna be packed with something in Chicago, and now you've got some time to get caught up. So I hope you get to really enjoy yourself and enjoy your Singapore chicken tonight with your son too.
Thank you. Thank you for having me. It was a
Thank you so much, Audrey. We'll have you back on, and of course, we're gonna see you in November at the
pleasure.
WDSS.
Yeah.
All right. Thank you so
So
much. Bye, everybody.